Dogs, like humans, suffer from dental issues and require dental treatment. If you don't regularly check your dog's teeth and gums, you may not notice a loose tooth until it's too late. Some of the causes of loose teeth in dogs, such as periodontal disease, aren't immediately apparent. In order to provide the best care and treatment for your dog's health and happiness, you must be aware of the signs. Tooth decay in puppies is normal. It's typical for pups to lose teeth as they get older, so don't be alarmed if your puppy has a loose tooth. Puppies are born with no teeth, and this condition persists for the first several weeks of their lives. Deciduous teeth, often known as baby teeth, begin to appear between 3 and 5 weeks of life. There are 28 baby teeth in a puppy's mouth, and they gradually fall out to create place for the adult teeth that will eventually erupt. 6 to 7 months after birth, the puppy's baby teeth fall out and its adult teeth begin to develop. As a result, a retained tooth may be formed in circumstances where the baby teeth do not fall out as expected. Even after the adult teeth have appeared, some baby teeth remain in the mouth. These are known as retained teeth. 1. Although the upper canine teeth are the most common ones to be left behind, this can happen to any of the teeth. Retention of a baby tooth might cause issues with the adult teeth and lead to an accumulation of plaque. Make an appointment with your veterinarian if you notice a baby tooth, and your veterinarian will most likely recommend removal it to avoid future issues. To avoid injuring the developing roots of the new permanent tooth, your veterinarian will take great care when removing any retained teeth. Symptoms of dogs with tooth decay. Refusal to brush teeth, halitosis. The gums seem red or bloody. If you see your dog's food or water bowls covered with red blood, they may be suffering from drooling. That's too much for their system to handle. Gnashing of teeth. Your dog may only be able to chew on one side of their mouth, or they may have a hard time picking up and swallowing food. Swelling of the face. The inability to eat. Sneezing and/or a runny nose. Mouth lumps or bumps. Inflammation of the mouth. Teeth looseness causes. As noted above, puppies' teeth may be loose because they are losing their baby teeth. Inflammation or infection of the tissue surrounding a tooth is known as periodontal disease. Periodontal disease is painful for dogs despite the fact that they may appear otherwise healthy. The collection of plaque and tartar around a tooth's attachment generates either periodontal pockets or gum recession, resulting in periodontal disorders. Leaving the infection untreated might lead to the destruction of bone within the tooth socket. Finally, the tooth becomes weak and can eventually fall off. There are several reasons why an adult dog's teeth may fall out, but this is one of the most prevalent. The dog should be sent to the vet as soon as possible. Injuries caused by collisions with moving vehicles, slips and falls and fights, or the inadvertent ingestion of stone or metal. 1. The gums, bone, and attachments that hold the teeth firmly in place can be damaged by cancer in the jawbone or gums. Adult teeth loss can be an indication of advanced gum disease in our dogs, which is uncomfortable for them as well as for us. More people than you might imagine suffer from some form of oral disease every year. And dogs are masters at camouflage. According to the American Veterinary Medical Association, if you don't take appropriate preventive steps for your pet's periodontal disease by the time he or she is 3 years old, it will increase as they age. 3. Having your dog's teeth examined by a veterinarian on a regular basis is the best approach to catch problems before they become serious. Treatment. A loose tooth requires veterinary intervention in all situations, except for the normal loss of puppy teeth, and it will not improve on its own or with at-home dental care. Consult your veterinarian if you suspect your dog has a loose tooth. If a tooth is found to be loose during the examination, an extraction under anesthesia will likely be indicated, as well as a cleaning of the teeth. Your vet will take blood tests on your dog prior to doing the dental cleaning and putting him under anesthesia. This will help the veterinarian evaluate if your dog is healthy enough to undergo anesthesia and detect any potential issues. Our pets, unlike people, require anesthesia during dental procedures in order to receive the greatest assessment and care. As a result, your pet's dentist will be able to thoroughly examine your pet's oral cavity, take X-rays to check for hidden disease, and perform a comprehensive dental cleaning while under anesthesia. Your pet will also benefit from this because it reduces their level of tension, worry, and pain. As a bonus, it keeps their airway clear of any water or debris that may otherwise enter when scaling away the tooth flap and end up in their lungs. To remove tartar and periodontal disease causing plaque, A dental cleaning will include a comprehensive dental examination, dental x-rays, teeth cleaning, and polishing. A dental x-ray and examination by the veterinarian will determine whether or not unhealthy teeth need to be extracted. It's done while your dog is under general anesthesia. It's much more pleasant for a dog to have their mouths treated in this way than to wait for periodontal disease to get out of hand, which is quite painful for our dogs. In order to assess the health of the jaw and the tooth roots below the gum line, dental radiographs, x-rays, will be taken. Dental cleanings and evaluations are performed under anesthetic due to the fact that the vast majority of dental disease occurs below the gum line, where you cannot see it. Your veterinarian will also prescribe antibiotics and pain medicine if necessary. Preventing dogs from having loose teeth. Annual veterinary exams. Having your dog's health checked by a veterinarian on a regular basis can help you avoid medical emergencies by catching problems before they become serious, painful, or expensive to treat. Care that is provided in advance is preferable to care that is provided after the fact. Veterinarians are now performing prophylactic dental cleanings on dogs, exactly like we do in our dental offices. This procedure necessitates anesthesia in dogs, but it is critical to their well-being. Ask your veterinarian if this is necessary for your pet. You may help your dog avoid or decrease the growth of dental illness by brushing his teeth daily. Make sure you buy a dog-specific toothbrush and toothpaste for this. There are components in human toothpaste that should not be ingested and can lead to stomach irritation or digestive issues. Dental goods are evaluated by the Veterinary Oral Health Council, a non-profit organization. You and your dog's doctor can discuss your alternatives together. Please subscribe the channel.